Hi, welcome everyone. Thank you for joining us today. In the next 1.5 hours, we'll be presenting 3 talks on plant-based nutrition. My name is Dr. Leila Dehkan. I'm a nutritionist at Plant-Based Health Online, and I'm also the education lead at Plant-Based Health Professionals UK. We at Plant-Based Health Professionals UK are very grateful to VegfestUK for giving us the opportunity to share the latest evidence on nutrition and health with you. And as we have only 30 minutes, I'm going to keep it really short. I just want to mention that, you're welcome to visit our website. I'll post a link to the website, and we have a lot of fact sheets, many videos on plant-based diets, and on our website. And you can also support our work by becoming a member. There are some benefits to being a member. I'm again not going to go into it. You can check it on our website. So, without further ado, the first speaker is Dr. Shireen Kassam, the founder of Plant-Based Health Professionals UK and a consultant haematologist at King's College London. Hi, Shireen, welcome.
Oh, hi, Leila. Thanks very much, and for putting together a wonderful programme. It's great to kick it off today. So we'll start off with my slides. But for people who don't know me, we founded Plant-Based Health Professionals back in 2018, and hopefully going from strength to strength. So I'm looking forward to really sharing a really interesting topic. I didn't realise how interesting and abundant the data were, and wish I had an hour to cover this. So go do share my slides, and hopefully I can see them at the same time as well. So just moving on to the first slide today. If you could just move to the next slide. What I thought I would just summarise before I get into the detail is that I've been really following this data on diet and COVID-19 from the get-go, really, from March 2020. I've written 3 articles now that you can check out on our website under the news section or on medium.com. And this is just going to provide an overview. So first of all, we made observations based on prior data from infections such as influenza and pneumonias that a healthy diet was going to be important in supporting our immune system during the pandemic. Shortly into the pandemic, it was noted that those with chronic underlying conditions had a worse severity when they did get the infection. And it was later realised that this severe infection was driven by excessive inflammation and also by poor vascular health. We've also now learned that high cholesterol and glucose drives the severity of COVID-19, and we know that the health of the gut microbiome is really important. And just in the last couple of months, there have been 2 large studies that really show us very compelling data that a plant-based diet may be a powerful tool in reducing the severity of COVID-19. So next slide, please. So we started off at the beginning of the pandemic, where everyone, including myself, was writing about how a healthy diet might support our immune system and the pandemic resilience. And this was the information from the WHO, essentially telling us to eat a variety of foods, particularly fruits, vegetables, and whole grains, in their unprocessed forms, cut back on salt, which we know promotes hypertension, but also we forget that it also damages the gut microbiome. Eating our fatty acids from plant sources, so unsaturated fats such as nuts and seeds and olive oil, and limiting sugar intake because this increases the risk of chronic disease and also inflammation. Obviously, water for thirst is most important, and avoid hazardous compounds such as alcohol, which we know adversely impact the immune system. Next slide. Now, our immune system is complicated, and it really is there to protect against infections and toxins. But if it's overactive, you might get conditions such as autoimmune diseases. And really, cancer, for example, is a problem with the immune system because we're not managing to adequately remove cancerous cells. So there's inadequate immune surveillance. On the left-hand side, you can see that in the purple, there's our innate immune system, which is things like the tears in our eyes or the lining of the respiratory system or the barrier function of the skin that sort of keep out the toxins and infections that we're exposed to all the time. And I'll come back to the gut microbiome because it's key in our resilience against infection. And on the left-hand side, you can see the adaptive immune system. We have the non-specific response. So when we first see an infection, the cells such as neutrophils and macrophages come into play and try and fight the infection. And then soon after a few days or even weeks, we get the more specific immune response to that particular infection, where the B cells produce specific antibodies, the T cell response is more specific, and then this creates a sort of a memory effect. So these cells that can fight that particular infection stay dormant and then can be reactivated if you get exposed again, which hopefully means that you're immune, or at least have a very reduced severity the second time around. Next slide. And we know that the factors that are important in keeping our immune system healthy are listed here. Now, as we age, there's a natural decline, but we can help support that through a healthy diet and lifestyle. Chronic illness impairs our immune system. The medications we use to treat these illnesses can also suppress the immune system. Environmental factors such as air pollution and other toxins. And as I say, diet is something I'm going to concentrate on today. So next slide. Now, at the beginning of the pandemic, lots of researchers wrote really good articles, and I've got a reference there at the bottom from the BMJ Nutrition Journal. And in addition to meeting calorie requirements and your protein requirements, it's really important to get a range of micronutrients, vitamins, minerals that are listed here that are abundant and plentiful in a healthy vegan diet. The caveat to that is obviously vitamin B12, which you need to get ideally from supplements. And Rohini Bajakel will be going through some of these key nutrients in her talk at 1:30, so do join her. Next slide. What was realised early on, and these data you can see are from February last year from China, that people with underlying health conditions had a vastly increased risk of dying. And these conditions were cardiovascular disease, type 2 diabetes, respiratory disease, and high blood pressure. And since then, we have got a more robust data from the US and the UK showing that more than 70% of cases that result in ITU admissions or death are in people with underlying health conditions. Next slide. And if you go back to data from 2019, we know that a diet is the key driver to these underlying health conditions. This was a study from 195 countries around the world, and it showed that diet is the single most important predictor of health outcomes globally. It's the leading predictor of premature death, resulting in 1 in 5 deaths globally, that it predicts for chronic disease, and that overall our diet quality is the leading predictor of longevity and vitality. Next slide. Now, early on in the pandemic, we realized that uncontrolled inflammation was driving this excessive response and then poor outcome with the virus. And you can see depicted in this diagram in the pink cells at the top, firstly on the left, the virus goes into the cell through the ACE receptor and it overwhelms that cell, and which ultimately gets damaged and dies. And when it dies, there's inflammatory signals and cytokines released. And this does two things. It activates macrophages, and it also in itself activates the T cells. But this macrophage activation at the bottom in the green then goes on to activate T cells, which then forms this sort of circular two-way positive loop that keeps creating inflammation and cytokines that then drive this inflammation. And we know that inflammation is driven by aging, and not much we can do about that other than adopt a healthy diet and lifestyle, but also carrying excess weight, these underlying health conditions. And we can choose a diet that's full of anti-inflammatory foods, like a healthy plant-based diet, and we can undertake physical activity and adequate sleep and stress-relieving activities that will also dampen down inflammation. Next slide. Now, it was also very clear early on that this illness was not just a disease of the lungs, even though the respiratory tract takes in the infection to start with, but it was a multi-system disease, and actually it was driven by infection into the endothelium cells, and these endothelial cells are a single cell layer coating the 60,000 miles of our blood vessels. So these endothelial cells have ACE receptors, and therefore the vascular system gets infected as well and damaged. And so this damage to the vascular system leads to inflammation, it impairs the immune system, it leads to thrombosis, and really can affect any part of the body. So the loss of smell, the inflammation of the heart, COVID toe, this is all caused by infection of the vascular system, which either causes a vasculitis, which is inflammation, or it promotes blood vessels to become clotted, so small clots in the extremities and in the brain, for example, can also cause a stroke. Next slide. Now, a key part of vascular health, but also in general, is keeping our blood cholesterol level low. And we've realized that high levels of cholesterol, particularly in the tissues, is a driver of getting the virus into the cells. So high cholesterol in the cells results in more ACE receptors on the surface, and this means that more virus gets into the cell that ultimately then creates inflammation and cytokine storm. Now, what's in the tissue is not exactly the same as the blood cholesterol, but there is a correlation. So people with higher blood cholesterol will have higher levels of tissue cholesterol, and we know that diet is a major driver of blood cholesterol levels, with those on a plant-based diet having the lowest levels. But also other drivers of high tissue level, again, aging is never a good thing, cardiovascular disease, being overweight, and type 2 diabetes. Next slide. Now, there's been a lot of research on blood glucose and COVID outcomes. Now, three main observations have been made. Firstly, that people with type 2 diabetes have increased severity from this disease and a higher chance of dying. That when you're ill with COVID and those people going to ITU, they have a higher blood cholesterol level that seems to be driving the inflammation and the thrombosis that happens. And thirdly, something we don't fully understand is that after recovery, people have an increased risk of developing type 2 diabetes. And this paper that's just recently been published brings together data from 240,000 open access studies and used a machine learning tool to seek out the bits that were relevant to blood glucose and COVID-19. And what it found was that every aspect of the virus is facilitated by having a high blood glucose level. So not only does high blood glucose level increase the chances of the virus getting into the cell, it increases replication, it increases the cytokine storm, and ultimately the organ dysfunction that's seen with it. And then, of course, we come back to the fact that a healthy diet can help keep your blood glucose at the lowest level possible and prevent and reverse type 2 diabetes. Next slide. Now, a fascinating thing is that 70% of our immune system actually resides in the gut. And of course, our diet really is the key player in keeping our gut healthy. And when we're talking about gut health, we're talking about the trillions of microorganisms that reside in our gut. We mostly know about the bacteria, but we have viruses and yeast and protozoa and all sorts of things. And fiber and polyphenols in our diet are really key to keeping the gut microbiome healthy. And when we feed our gut microbiome adequately, they create these metabolites or compounds called short-chain fatty acids, which stimulate our immune cells. And this actually creates a healthy immune system in our gut, but actually in all different body organs, because these chemicals signal throughout the body and create a healthy immune system at places that are very distant from the gut. So, for example, there's communication between the gut and the lung, and the health of the gut impacts the lung immune system. It also signals to the brain, and we also know that it signals to the skin and the joints. So it's really fascinating. But what's key to a healthy gut microbiome is the diet we eat. So next slide. We started to get a hint that this might be important from this sort of observational study published last year. And what the study asked was, why is there such a big difference between the outcomes from the pandemic virus between different countries? Could diet be responsible? And it analysed diet data in different countries and noted that with the increased consumption of fermented foods, there was a reduced mortality by about a third. And also that eating cruciferous vegetables, particularly cabbage, reduced the severity. And they postulated that this might be because fermented vegetables and also cabbage and cruciferous vegetables activate the transcription factor NRF2, which we know controls inflammation in the immune system. And in fact, people have been talking about how to activate this compound NRF2 to combat the adverse outcomes of COVID-19, but we can do it by food. Now, of course, this doesn't show food, cause and effect, but what it suggests is that it might be a useful thing to keep our gut microbiome healthy. Next slide. A better study that came along earlier this year looked at the health of the gut microbiome by analysing stool samples in 100 people who'd been hospitalised in China. And they looked at the composition and found that the gut microbiome is associated with disease severity, and that it also impacts the level of the blood inflammation markers and the level of tissue damage created by the virus, and that the more severe COVID-19 you have, this was associated with depletion of those bacteria that are known in regulating the immune system. And also these abnormalities persist even after you clear the virus, suggesting that the gut microbiome might be important in this newly described syndrome of long COVID. Now, of course, we don't know if this is cause and effect. We don't know if we improve the health of our gut microbiome, whether we'll have a better outcome from COVID, but it really does make a lot of sense. So next slide. So what we can do to improve the health of our gut microbiome is concentrate on having foods that are rich in prebiotics that feed the bacteria, and these are abundant in our plant-based diet. So onions and garlic and asparagus and beans and oats and soya, and really incorporating fermented vegetables and foods might be really important in promoting gut health. And this is easily done on a plant-based diet. You can ferment at home or buy products that are fermented, such as kimchi and tempeh and sauerkraut. And we know one of the key factors in promoting gut health is the diversity of the plant foods we eat. So more than 30 different plants a week is really associated with better gut health. Next slide. And we've had a lot of chat about vitamin D. It's crucial in the health of our immune system. We know that people who are deficient in vitamin D have a higher risk of respiratory infections and infections like influenza. So, of course, it could be important in COVID-19. And now we've had a meta-analysis of 14 studies looking at vitamin D levels and COVID-19. And there is a significant association between low levels and of vitamin D and a higher risk of actually getting COVID-19. So we must make sure we've got enough vitamin D, and if we're not getting enough sunshine, then we need to take adequate supplementation. Next slide. So what we're talking about here is aspects of our health that really can be benefited by eating a healthy plant-based diet: fruits, vegetables, whole grains, beans, remembering to use water for thirst. Tea and coffee is absolutely fine, full of polyphenols and health-promoting compounds. Eating a portion of nuts and seeds, which is crucial for cardiovascular health, and remembering to get adequate sources of vitamin B12, vitamin D, and iodine. Next slide. And this is because we have data prior to the pandemic that plant-based diets can reduce inflammation, reduce cholesterol, reduce glucose, prevent diabetes, even reverse it if you need it to. It can protect the endothelium through eating lots of nitrate-rich green leafy vegetables. Beetroot is also rich in nitrate, and also antioxidant and anti-inflammatory compounds in herbs and spices and dark vegetables and fruits are really important to protect this vascular layer. And of course, we've talked about the healthy gut microbiome. Next slide. So we finally got 2 large studies that show that a plant-based diet may be key to pandemic resilience. The first study was nearly 3,000 healthcare workers, mainly physicians from 6 different countries, who reported their diet habits, and it was looked at whether they had COVID-19 infection, and if they did, how severe it was. And the study showed an association between a plant-based diet, which had a 73% reduction in the risk of developing severe COVID-19. Conversely, people or physicians who were eating a low-carb diet that was high in animal products had a 3-fold increased risk of severe COVID-19. Now, despite the headlines, this was not a study of vegans and vegetarians, and the participants weren't particularly eating a healthy plant-based diet. But what was noted was that those who were described as plant-based were eating more vegetables, beans, nuts, and much less poultry, red meat, sugar-sweetened beverages, and alcohol. Next slide. We have a much more robust study that was literally just published last week in the journal Gut, and these brought together data from the now famous Zoe COVID app study, can't speak. And it brought together data from 500,000 participants in the UK and the US. And what it showed was that when you analyze the data on diet and you classify it using the healthy plant-based diet index, which gives positive marks for healthy plant foods, negative marks for unhealthy plant foods, and also negative marks for all animal-derived foods, what they found was that a healthy plant-based diet reduced the risk of COVID-19 by 10%. That means you had a 10% less chance of actually getting the virus, which is quite phenomenal. But the major impact was on the severity. So you could reduce the severity of COVID-19 by 40% if you had a healthy plant-based diet. And the researchers concluded that based on these diets, what they calculated was that nearly a third of COVID-19 cases could have been prevented if these differences in diet quality and wealth had not existed. Now, to comment about that, what they found was a healthy diet really had the greatest impact in those of lower socioeconomic means. So this disparity in socioeconomic outcomes with the COVID-19 pandemic really could be addressed by addressing the quality of diet. Next slide. So this just shows the abundance of these health-promoting compounds that are present in a healthy vegan diet. It's full of vitamins and minerals. It's full of nitrate-rich vegetables. We've got herbs and spices full of antioxidant and anti-inflammatory compounds. We've got vitamin C. We've got flavonoids, and drinking teas like green tea are really important. So we need to have an abundance of healthy plant foods and nutrients. Next slide. So I just wanted to share a pandemic story with you. And this is my dad on the left-hand side. He's actually turned 78 now. He's got quite a complicated past medical history, which included a Whipple's operation back in 2004 that actually removes a portion of your pancreas. And people who've had a Whipple's have got an increased risk of diabetes. So it's quite a wonder that my dad took over 16 years to be told he was pre-diabetic. And that happened in September 2020. When he went for a routine check and was found to be overweight, which of course we knew anyway, but his triglycerides were sky high and he now met the criteria for pre-diabetes. Now, I wasn't sure that he was going to be able to reverse this, but we thought we'd give it a very good try. And he saw my friend and colleague who you'll be hearing from, Rahini Bajekal, who helped him adopt a healthy plant-based diet. And I have to say that it's got to be noted that he'd been vegan for the last 3 to 4 years. So, saying you're vegan doesn't mean you're having a healthy diet. So Rahini helped him adopt a healthy South Asian diet full of vegetables and lentils, daily walks, resistance exercise. And I'm happy to say that in April of this year and until this day, he's now reversed his pre-diabetes and brought his triglycerides back to normal and maintaining a healthier weight, although he does need to be a bit less because South Asians really need to have a BMI less than 23. So it's never too late, and really you can make a change in a short period of time. Next slide. So hopefully what I've covered and convinced you about is that diet is the single most important risk factor that's impacting our health, both from the communicable diseases and non-communicable diseases, that underlying health conditions caused by an unhealthy diet increase the risk of severe COVID-19, that inflammation, high cholesterol, high glucose, that can all be combated by a healthy plant-based diet, are really contributing to COVID-19 severity, that we should be concentrating on the health of our gut microbiome as a key to reducing the risk of severe COVID-19. And now we have 2 large studies showing that a healthy plant-based diet might be important in reducing the risk and severity of COVID-19. Next slide. So I leave you with this quote from this excellent editorial written in the BMJ journals. It says that it seems clear from the data available that nutrition is one of the keys to global pandemic resilience, both the current and future pandemics, and could reduce burdens on healthcare systems. optimum nutritional status is a defense against both communicable and non-communicable diseases. It is also something that can be attended to right now and is not months away. We are ecological creatures at a crossroad. Let this pandemic be your wake-up call. Next slide. So if you want to optimize your diet and want a bit of support, then Leila Dakin has created this 21-day email support. So sign up for free on our website. Next slide. If you want to have a one-to-one consultation or a group consultation about your diet, then reach out to us on Plant-Based Health Online, where we will help you optimize your diet and lifestyle. Next slide. And I offer this course at Winchester University if you want to take your nutrition knowledge to the next level. Next slide. And some shameless advertising. My book, co-authored with my sister, will be out in January 2022, but you can pre-order it from all the bookstores right now. So thank you very much for listening, and I might have a couple of minutes for some questions if there are any.
Thank you, Shireen. That was very interesting. And, what I really find actually interesting was the part about the impact on diet, even if there are any socioeconomic, differences, because COVID-19 obviously highlighted those health disparities. But adopting a whole food plant-based diet could make up for some of that. That's really interesting, isn't it?
It really is, and I think that that's key to policy going forward, that a healthy diet is accessible and affordable, and we do our bit about educating people how to put that together in practice. But yeah, we need to make sure that it is accessible to everybody.
Thank you. So there aren't any questions. I think just people saying how great the presentation was beautiful, and they really enjoyed it. And I can just second that. It was really very useful, and I think very important, considering that we are still in the middle of the pandemic. Thank you very much.
Thank you.